Dr. Peter.
Hello, sir.
Another episode again.
As in.
Okay, so today we are talking about causes of back pain, and this time around not just in like specific like the broader causes of back pain, and you are looking at in between spinal and muscular causes of back pain. So can you throw more light on this?
Okay, so thank God for my model here. So now this one I will use to show everybody. But anyway, there are different causes of back pain. Different. So which one do you want me to start with?
Let's start with the difference between the both of them.
Okay, so the difference is the fact that a muscular sprain might actually lead to back pain. There are many layers of muscles at the back, starting from the muscles that attach to the bones, to the spinal bones of the back. There are muscles that attach to this one, and then there are other muscles that actually go on top of that. So sometimes when there is a sprain or a tear in that muscle, it could mimic back pain coming from the spinal cord itself, which actually is not the case. So that's one. We have spoken about sprains, we have spoken about injuries, even sometimes malaria, like severe malaria, could actually lead to generalized body pain, and then it could also affect muscles, muscular pain as well. So people who have undergone strenuous exercises, physical activity, let's give the examples of bricklayers and all those that actually do a lot of physical work, poor posturing, instead of bending with your knees to lift an object, you bend with your waist. When you bend with your waist, you strain the backbone, and then when you are coming up, it comes up like this. So that strains the muscles, and that can actually lead to severe muscle strain, which would predispose one to having back pain. So all these are things that actually happen to muscles. So this can now lead to severe muscle spasm. And this muscle spasm can go on and on and on until that insult has been, rectified or stopped. So this can actually be a chronic process. Yes, so these are muscular or musculoskeletal causes of back pain.
So let's talk about the spinal causes of back pain.
Okay, so now the spinal causes of back pain, usually they are due to degeneration of the cartilage that actually helps as a shock absorber to the spine. You are able to move your back, to dance or to twist because of this biscuit bone or brisket bone, the cartilage that acts as a shock absorber for your back. So we are able to move our backs because this particular mechanism allows for flexibility. So over time, as we age, they tend to degenerate. When they degenerate, they could lead to this bulge. It could lead to this bulge over time that puts pressure on the nerves that passes through them. I don't know if it can be shown properly. So it puts pressure on the nerves that will pass through them. And usually the kind of pain felt here is kind of different because the pain is going to feel like shock. It will feel like shock. It will feel like muscle pull that might shoot down the leg. So if the patient is having lower back pain, that's lumbosacral cause of back pain, they would complain of, I don't know, the Yoruba calls it what? Baja. Yes. They will complain of that, and that's what we call like muscle cramping, claudication. Some people may say it feels hot, and sometimes it feels cold, and sometimes it feels like a shock, like they are having shocks going down the leg. So this is now a nerve pain. It is a nerve pain caused by the compression from this biscuit bone.
The biscuit bone is pressing.
Yes, it's pressing on the nerve. Yes, now the nerve is trapped between the bone behind and the compression in front of it. And nerve pain can be one of the worst pain a person can feel on the surface of this earth. And the nerves, it will take a lot of time before they recover. And it also depends on the degree of the compression. So now, how we tend to differentiate is there are several tests that we tell the patient to do. Sometimes we can tell them to perform a test as simple as raising the leg up while they are lying down. When they raise the leg up and the pain is worse, or they feel that shocking sensation, then it is most likely a nerve related cause of back pain. Sometimes we could tell them to lay on their belly and then raise the leg up like they are raising it backwards, and then they feel that particular kind of pain. It could be so severe that the patient may not even be able to walk for 10 minutes. Because when you walk, the muscles are constantly moving, the backbone is constantly moving, and the nerves are being rubbed. They also have to, to move a little bit, or the muscles are also rubbing on structures very close to them. So the pain will definitely be there.
Okay. So what are the common myths and misconceptions about back pain?
The one I know very well is they will come and tell me. In fact, people will actually come and tell me. They will say it's because of sugar. They will say it is sugar that is causing the back pain. Then somebody will now say motilum muagbo, and that thing angers me a lot. And I will tell them, how do you know it is sugar? Have you done any fasting blood sugar or random blood sugar? And I always tell them, for sugar to actually cause back pain, quote and unquote, it means that your body is already unable to control sugar. I mean, we have insulin that helps to control sugar. So sugar won't just be dumped in your blood and suddenly go to your back to start, dancing there and creating a scene. I mean, there are other things that sugar would cause that we would know that, okay, yes, you indeed have deranged control of your blood glucose, right? But they will always say sugar. It's not the sugar. It's most likely muscle strain or nerve related issue. And people who actually take this agbo, they don't even know what it contains. Some people may have actually gone to mix some pain meds in the agbo, or maybe some of these plants may have components that actually control pain, and they think it is the leaf. But they don't know that, of course, we get our drugs from plants, right? But do they even know the dose they are supposed to use? Are those things they are drinking sterile enough to be safe enough for them to use? Do they know the state of their kidneys where they go to drink these things? Do they know the state of their livers? No, they don't know. They just feel, they should drink and takes the pain away.
So Dr. P, I see that you are really, really
passionate.
You are passionate about this misconception.
I'm telling you.
So that takes me to my next question. How do trigger points, I'm talking about musculoskeletal, how do trigger points and muscle knots contribute to back pain, and what treatments are available to remedy them? Okay,
those trigger points will be the pressure points. And usually, once they have been affected, and once those pressure points have been triggered, that's where the pain will start from, right? So usually, let's assume someone is trying to lift something heavy and they don't follow the right mechanism of lifting. You just go bend with your waist. Let's say you want to lift a bag of rice, and then you just bend with your waist and pick it up. The trigger points would be felt. Like you can actually point to where that pain is. It's different from nerve pain, where you may not be able to point because it's a referred pain. But the trigger point of muscle pain, you most likely would be able to point to where that area of the pain is. And once injury has developed there, it will take some time to heal. But in our climb, when someone has triggered a point, we still continue to, we continue with that lifestyle, with the poor lifestyle, with the hope that it will go, no pain, no gain. But then it continues to degenerate from there. And usually the treatment option that we offer is, of course, we tell them to do X-ray. At least let's see the condition of the spine. Then we send them to physiotherapy and advise on lifestyle modification. Do not lift heavy objects. Don't sit for longer than 2 hours. When you want to lift anything, ask for help and try to lift with your knees so that your spine is still assuming an upright posture, not bending. So these are some of the things, and of course the use of pain medications as well will be employed.
Okay.
But physio is very important in this case.